numbers are not enough, and you need numbers plus a narrative. And for me, that's been crucial in getting my message across in the organisation in which I work. As a result of attending the course, I now acknowledge the importance of asking people, what matters to you. And I used to assume that, but now I often ask that. And I often ask it to the patients, but increasingly I'm now asking it to the staff, my colleagues, my team. Because I think the understanding, the perspective that everyone's got a slightly different perception of what is actually happening in terms of healthcare at the moment. I think it's really critical to understand what their perception is, because your perception is your reality. So if a member of staff doesn't feel acknowledged and valued, they find it very difficult to care and give compassion to the patient. So I think increasingly, as a result of this course, I've understood that it's critical that we get and measure and use staff experience to then measure and use and improve patient experience as a starter.
As a sort of Myers-Briggs E-type, my tendency is to over-contribute, and as a surgeon I tend to dominate. And as a surgeon, what you learn is to be quick, so you learn to act quickly, because that often makes a big difference. When you've got an acute situation, you've got to be decisive. And that command and control approach works for certain situations. There are some crises that need that, but most things don't. And so I think it's developing the adaptive leadership bit, the wicked problems that no one's solved for years, and how can we deal with those, that's been really important. And actually having the opportunity to test it out in a relatively safe environment. So my project was about a small hospital, relatively small budget, etc., which was struggling. And I have had the time to go and engage with a wide variety of people and discuss their vision for this place, and find out where the common ground was, and then develop the project on that basis, which has been so successful. We've taken a hospital that was half full, losing money, not providing good service for patients, and we're now over full, providing relevant services. We've introduced paediatric services where there were none. We've got frail elderly assessment where there wasn't any. We've balanced the books. Not that that was the main aim, but that helps. And people have been genuinely excited about the project in a way that you don't always see, which is really good. It's given frontline staff the opportunity to get their teeth into something that really means something to them.